Hello, কি নাম ওর?
সামিম হোসেন।
সামিম, how are you? Fine. আচ্ছা, ভালো আছো তুমি? ভালো আছো? আচ্ছা, তাহলে আমরা এখন সামিনের অ্যাবডোমেনটা দেখবো, হ্যাঁ? We will first inspect it from side, then we will inspect it from the foot end. So there is any asymmetry or there is no asymmetry. There is symmetrically distributed all over the abdomen. And then we are looking for any visible movement, any scar mark. There is no visible movement. The child looks appropriate for his age. He's 3 years of age, so he looks appropriately for his age. And we will like to plot his height and weight, but on inspection he is grossly edematous. He has puffy eyelids. His abdomen is distended, and he has edema, pretibial edema, pretibial mild edema, not so much. History, he has oliguria and generalized distension for last 4 days. And I like to measure his vitals, pulse, respiratory rate, and also blood pressure. And I like to check is there any urine pot for urine for protein heat coagulation test. And I inspect the child. There is no distress, no dysmorphism, and I saw there is a gross abdominal distension. Now I like to palpate the child with the permission. First I will do the superficial palpation from the left iliac fossa. Then I will go anti-clockwise in the spiral manner. I saw and I look at the face. There was no tenderness, no pain. Now I will go for the deep palpation. Deep palpation is the organ palpation. I will check for বড় শ্বাস নাও, okay? I'll check for the liver. বড় শ্বাস নাও,
নিঃশ্বাস ফেলো।
হ্যাঁ, শ্বাস নাও, হ্যাঁ, শ্বাস নাও, good. শ্বাস নাও, শ্বাস নাও, okay. I do not see any liver. Liver is not palpable. Now I palpate the spleen bilaterally. আমি তোমাকে একটু দেখি ব্যথা পেলে আমাকে জানাও. So I am palpating the spleen obliquely from the right side to the left side obliquely upwards to palpate the spleen. I do not see any spleen, so just to katho baba, to katho, ei pashe anti pashe acha, okay. I'm not seeing any spleen. Betha peso? Acha, thik ache. Then I'll check for the percussion. So on the palpation, there is no superficial tenderness, there is no, on the deep palpation there is no organomegaly. I like to check the kidney by manual palpation. I do not see any kidneys palpated. No, by manual palpation I do not see any kidney is palpated. And then I will check the fluid thrill, and because the abdomen is grossly distended, so I like to measure the fluid thrill also. এখানে আমি একটা হাত দিবে, এখানে বাবা আপনি একটা হাত দেন, এখানে একটা হাত এখানে দেন, এভাবে এভাবে দেন, এভাবে হ্যাঁ। So I'm checking the fluid thrill. At the same time I'm looking at the child to see is there any pain. No, the fluid thrill is positive, but the child's face is not painful. Okay, now I will go for the shifting dullness, because the fluid thrill is also positive, so no need of shifting dullness because there is a huge ascites. But for examination purpose, I like to show how the shifting dullness should do. So first of all, I'll start percussing from the xiphisternal, below xiphisternum. Then I will see for the abdomen is also dull. Okay, I cannot see any tympanic sound. The abdomen is also dull. But yes, in the top there is some tympanic sound. Yes, at this border I see there is some dull sound, and here is the intestinal coil, so there was some tympanic sound. Now I'll roll up the child with the help of the mother. Ashen, okay, to cut korone pashe. Okay, bolen pashe to cut. Okay, to cut. Okay, pashe to cut. Yeah. And I will wait. I'm not releasing my finger. I will wait for a few seconds so that the fluid can shift towards the opposite side. And then, see, the sound is now tympanic. So I will roll. I will do by here. I will go. And now here I can also find I can also find dull sound. So I can see that when I roll the child, all the fluid shifted to the opposite side. And so I find some tympanic area, and then again I found here dull area. That means fluid has been shifted. So by this method, fluid shifting test and fluid chill test also positive in this child. Now I will check for, I already checked for the periorbital edema, and with the permission of the mother and the child, I like to see the genital area, but I already saw with the permission and the genital area is swollen. There is scrotal swelling and penile swelling. And also I like to check the, like the back area. Is there any sacral edema? There is no sacral edema. And also I like to see the tenderness on the kidney, and I like to see the facial expression of the child. It is non-tender, kidney region is non-tender. And in order to complete my examination, I would like to auscultate the lungs for pleural effusion, because they can have pleural effusion. To dekhi baba, to dekhi aunty. Shash na, bol bol shash na. Shash. 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 Two pashe jao, two pashe jao. Hamari two pashe jao. Shabash. Okay. I also have to listen to the bowel sound. Bowel sound is present. I can also listen the kidney bruit or hepatic bruit, but there is no kidney is non-gallotable and liver is not palpable, so I will not do this. So in order to complete my examination, as I already told, I like to see the port, urine port and blood pressure, because my differential diagnosis is a case of generalized edema, so maybe it's a case of nephrotic syndrome. Differential, I can think about nephritic syndrome, angioedema, or protein allergy malnutrition. But in acute glomerulonephritis or nephritic, the child will have fever or toxicity, the child will have high blood pressure, and there will be urine for blood, and there will be hematuria. But in this case, these all are absent. And in protein allergy malnutrition, the child will have very low weight, height, but the child looks very well and appropriate for his age. So this is not a case of protein allergy malnutrition. And also it can be a case of angioedema, but the history suggests there is a low urine volume for last 4 or 5 days, and it's a first case, it's a first presentation of nephrotic syndrome, so mother did not try to check the urine. And angioedema, hereditary angioedema, there is other family history is involved, but here is no family history. And in case of allergic angioedema, the child will have a history of anaphylaxis or maybe itching, taking any nuts or cow's milk, but there is no history of itching, cough, or any problem of anaphylaxis. So this is not a case of angioedema. That's all. Thank you, everyone.